Thank you everybody for joining me on your Tuesday evening, and welcome to preparing for the M3I. Ooh, cool name. MMI. You know, McGill's too cool. So we're doing that. So the focus of today's presentation is the MMI and the interview day. Okay, so we have presentation on the Casper, on the application, and so on and so forth. If you want access to those, please give us an email and we'll happily send it to you. But today's is on this part of the application cycle. And a little bit about me, I'm a first-year medical student at the Mayo Clinic. I've been accepted to both Canadian and US medical schools. I applied 2 cycles. So the first cycle was just two medical schools I interviewed at, got into none of them. In Canada, the second cycle, I got into Canadian and US medical schools. I've done 6 MMIs, so I've seen every kind of MMI there is to be had. And right now I'm at the Mayo Clinic Alex School of Medicine. So the Mayo Clinic is the #1 hospital on the face of the planet. It's a privilege to be here. And that's why I'm choosing to go into crazy debt instead of going to Canadian schools. So if you have any questions about American admissions as well, or Ontario admissions or anything, in addition to Quebec, feel free to ask me. And the point of this presentation is, what is the difference between great answers and extraordinary answers, okay? Which is what I find to be the secret to the MMI. So I'm not gonna bore you with this. The format is 8 to 10 stations for your McGill MMI. And it's, discussion based. You might have task oriented things, scenario simulations. They might show you a picture. There's a lot of things that could be going on, and it's synchronous. It's over Zoom, okay? You have all the details, so I'm not going to bore you with those details. But for your interview, I would spend a lot of time looking at these topics. So again, to everyone who's joined, we're going to send you these slides, so you don't have to write them down. But these topics are essential to have a firm understanding of in order to be able to succeed in your MMI, because you could be asked on hot topics that are relevant to Quebec and to Canada as a whole. Furthermore, you need to not only understand these topics, know the facts about them, but be able to deliver expert opinions and really a compelling argument on these topics. You need to be able to have an opinion on them and be able to articulate it very clearly. Now, there are also these other topics. So I told you at the beginning that I applied to medical school for 2 cycles. The first time I interviewed at 2 places, I did not get in. The second time I got into Canadian and US medical schools. Okay, what was the difference? The difference was the first year that I applied to medical school and I interviewed, I would have great answers and great opinions on these topics. However, I would miss the bigger picture of things, like housing in Quebec, mid-level providers, cancel culture, the wealth gap. Okay, I can't tell you how many times in my interviews I was asked about things like cancel culture, like several times, cancel culture. And I was like, man, I just spent the last 2 months studying about organ donation. I was studying like medical assistance and dying. And now they're asking me about cancel culture. So the second time that I interviewed was a time where I started going to these expanded topics that are not directly related to medicine, right? Because the first list, these are all things that are directly related to medicine. The second one are things that actually affect people on a societal level. Because the thing is, if they do that, what does that mean? It means it's actually a public health question. And public health is a huge theme in medical school interviews, especially MMIs, especially MMI at McGill. So I would spend a lot of time understanding things from a diverse lens, not only looking at healthcare topics, not only going to healthydebate.ca, everybody does that, but understand the broad spectrum of what's going on in Canada and Quebec and the world. So I believe the best way to learn is always to practice. So let's do a practice question together, okay? Can everybody read this? Imagine you are a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? So it's a possible question that you could be asked, okay? Now, let's look at the answer. To answer this, you could say, I would conduct a comprehensive assessment of the patient's pain. I would have open conversations with the patient about their pain experience and treatment history. If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means I would regularly review it and adjust as needed. And then you could give a conclusion. So someone tell me in the chat or unmute yourselves, Is this a good answer or not? And I promise you, I will not go to the next slide until someone does that. Put it in the chat or someone unmute. Is this a good answer to this question? It does address the main points of the question, like you said. And here's the thing. The first year I was interviewing, this is the sort of answer that I would have given. And I would interview, and I'd say, oh, well, I crushed that interview. I did very well. Why didn't I get accepted? I got waitlisted and rejected at McMaster in Ottawa, my first year, right? Let's look at this extraordinary end. Let's look here, okay? What else could we have said? I could first explore a multidisciplinary approach to treating pain. For instance, physiotherapy, lifestyle modifications, exercise, diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. And what if we go further? What if we go even further? What if we make connections to the opioid crisis? Every metropolitan center in Canada and in the rural areas too, especially in the territories, are dealing with opioid crises. Okay, and that's in the chat. I see Ray Wayne. It doesn't talk about opioid addiction issues. Exactly. There are opioid crises going on in Montreal, in Quebec, that we could have mentioned here to make our answer stand out. We could talk about sickle cell disease and racism with respect to opioids. So for instance, young black individuals will come into the emergency room in pain, and they might have sickle cell disease, right? But it's underdiagnosed because the genetic mutation for sickle cell disease is more prevalent in black populations because it confers resistance against malaria. But anyways, they come to the emergency room, they're in pain, and they want drugs for their pain. And the doctor might think, oh, well, this person just wants opioids, right? So we're completely dismissing their needs because of the stereotype. You could discuss specific medical cases relevant to Canada or Quebec. You could briefly talk about the science of opioid addiction. Maybe you've taken a course on cell biology and you can talk about, the reuptake receptor and so on and so forth. Obviously, you wouldn't talk too much about that, but that's a really cool thing to talk about. Maybe you could talk about naloxone training. Maybe you've been in the streets doing street medicine, treating people who have overdosed on opioids, and you can talk about that. All right, these are all the ways. This is how I started answering questions in my second year interviewing. And this made all the difference and helped me get into both top Canadian schools and US schools, like the Mayo Clinic, which is where I am right now. This would be the level of my answers compared to my first year, where it would just be the first one, which is still a very good, mature answer. And by the way, all the questions we're going to do today come from our website, thebrightdoctor.com. This one comes from our opioid crisis question bank, but we have question banks on a lot of topics. And the answer that you saw comes from there. And so does ideas to go beyond. Like, for example, you could talk about prescription drug monitoring programs to track opioid prescriptions. Quebec and all the provinces in Canada have opioid stewardship programs to track how much opioids are being prescribed by physicians, because you don't want to overprescribe them, right? So there's tracking programs, and you can mention stuff like that. So why do we need to provide extraordinary answers? Why? And here's why. Okay. At McGill, at every medical school, there's 600 people interviewing. There's hundreds of people interviewing, and only 30 to 40% will get that acceptance letter, especially when you might push 40 when you talk about the wait list, but it really is, you need to stand out. And you all have amazing GPAs, probably, amazing CASPER scores. I don't think McGill takes MCAT from Canadian citizens, so you don't need that. But you have amazing activities. That whole form, this curriculum vitae that you had to fill out for McGill. You've all spent years perfecting your applications, maybe you've done a master's degree, okay? Everyone belongs in medicine. Everyone belongs and deserves that seat at the medical school. But when everybody is so brilliant, if everyone is so smart, how are you going to stand out? And for me, I really like this picture because the first year I would be this guy up here. I would listen to the same podcasts as everybody else. The CMAJ, I think you've all heard of that, the Canadian Medical Association Journal podcast, White Coat, Black Art. I would read the book Doing Right, right? I would do all these things that everybody else was doing. Go on healthydebate.ca. I would go on CBC Health. And these are, of course, these are great resources. But if everybody is doing this, if everybody's reading the same thing, how are you going to stand out? How are you going to provide an answer that is distinct enough, which puts you in the top percent? Because MMIs are graded on a Likert scale. You're given like 1 to 5 or 1 to 10 on how well you did on that question, and you're compared against other people. So everyone can give great answers, only a certain percent will get accepted. And the second year, I became this person, and I will show you what I did to become this different person and start giving different answers that help separate me from the pack. Okay? And really, the ways you can stand out in the MMI come down to 5 things. It's either you address more perspectives than others, you offer more alternative solutions, which can be creative solutions or how you can avoid a certain issue in the future. You're a better speaker than other people, which means you're either more personable, more amicable, you have a more organized answer, you have less ums and ahs in your answer, or you look at the camera and you speak with confidence. You can make connections to your personal life. So for example, with the opioid question, you could have talked about some overdose prevention program you were a part of, or a club, or maybe any naloxone training you've had to your future career, or you could demonstrate specific domain knowledge, like talking about the science of opioid addiction. And lastly, explaining why. So a lot of times at MMIs, I have colleagues who, or friends back when I was applying, who would have the coolest answers. I would make an app. I would make a website to do this, blah, 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 blah. They would never say why. Well, why is an app the best way to do this? Or why is a website? So just saying why will get you very far ahead. And I bolded this sentence right here, looking at the camera and speak with confidence, because everybody knows a smart aleck. This is a guy or girl in your class who will speak like they know everything, but really they don't know anything. And all they, they're very condescending when they speak to you. The difference is smart alecks will look at you in your eyes and they will speak with confidence. They will tell you that a giraffe's neck is on average 20 feet, and you will believe them because they said it. I mean, there's no reason to not believe them, but I made that up, right? Smart alecks get very far in this process, believe it or not, because they can look at a camera and speak with confidence, whereas other people who are very smart, very brilliant, they don't know how to organize their answer, they don't know how to say it with confidence to the camera, and they're timid, okay? So don't become a smart aleck, but learn how to speak like them. Now, should you speak for the full time? This is a synchronous interview, so you're on Zoom with McGill. The answer is no. You do not want to speak for the full time in general, because there can be follow-up questions, okay? There can be follow-ups a lot of the times. And in my personal opinion, if you have 7 minutes to answer, you say your answer in 3 or 4 minutes, and you let them ask you stuff afterwards. Because sometimes, and I see this a lot in my experience, I will say some stuff and I will miss something. But then in their follow-up, they will probe me and they will let me touch on topics that I didn't address in my original answer. So they kind of want to help you. If you miss something in your original answer, they will ask you about it. And if you talk for 7 minutes straight, they don't have time to ask you about it. So simply when it's synchronous, you do not want to talk for the full time. Little Ray Wayne says, it doesn't talk about opioid addiction issues. Oh, sorry. I'm reading that from before. Never mind. So now, should you go in depth or broad? So my approach is always, if you have a lot of ideas, pick 1 or 2 to go in depth in your answer. And then you can acknowledge other viewpoints either beforehand or towards the end, briefly. Because you don't want to spread yourself thin and give a very unorganized answer where you talk a little bit about everything. Now, let's do a very unique question to McGill and Quebec. Discuss the unique healthcare challenges faced by Indigenous communities in Quebec and potential solutions. I have a way of structuring my answers, and I will get to that as well. But if it's like a question on medical assistance in dying, right? For example, medical assistance in dying, you know that, right? Euthanasia, for example. how I would start is I would have an introduction where I talk about my understanding of the topic. Yes, medical assistance in dying or euthanasia is a very contentious topic, and Canada is a pioneer in this space. In fact, in 2021, we expanded medical assistance in dying to include patients who do not face terminal illnesses, right? And now the Joint Committee on, there's a committee on something, is saying that Canada should also extend it to people with mental health illnesses or even minors with terminal illnesses, right? Children under 18. So there's a lot of questions, a lot of ethical questions in this matter. And in my answer, I will first talk about the pros and cons of this policy before giving my final opinion. And then I will maybe talk about a personal experience that I've had in this area.
Okay.
So you have a lot of ideas, but I guarantee you a lot of those ideas can be part of the introduction, your understanding of the topic, So I know all those cool facts. I know all those cool facts, and I use them to as the introduction. So I tell the person, I've researched this, I know this, and then you're going to talk about deeply your opinion, pros and cons, which is just two things, and give a conclusion. Make sense?
Yes. Thank you so much.
And as you're going to see, we're going to have more questions and answers. You will see exactly how you can organize this. So don't worry. Now let's look at this. Discuss unique healthcare challenges faced by Indigenous communities in Quebec and potential solutions. The unique healthcare challenges faced by Indigenous communities in Quebec are deeply rooted in a history of colonialism, systemic racism, and long-standing disparities in access to healthcare services. These challenges are exacerbated by socioeconomic factors, cultural insensitivity within the healthcare system, and a significant lack of resources dedicated to Indigenous health. The tragic case of Joyce Ishaquan, right, who faced racist harassment by medical staff before her death, starkly highlights the urgent need for systemic change within Quebec's healthcare system to address these deep-seated issues. So boom, you immediately give your understanding of the topic. Colonialism, you could even talk about things like forced sterilizations, residential schools, things that caused Indigenous communities in Quebec and Canada problems, especially in these past, decades and centuries. So that's a beautiful initial paragraph. Then you say, to address these challenges, a multifaceted approach is required. It's essential to recognize and dismantle the systemic barriers that prevent Indigenous people from accessing equitable care. This includes acknowledging and addressing the racism and discrimination that Indigenous patients face within the healthcare system. Following Joyce Ishaquan's death, the Quebec government pledged $15 million to improve access to healthcare for Indigenous patients and provide cultural training to employees in the province's medical network. Beautiful. You're talking about what are the problems and now what is Quebec doing? So you're already going beyond by mentioning, specific facts that this is what Quebec's doing, and you're mentioning specific events. This initiative aims to foster a more inclusive and respectful healthcare environment for Indigenous communities. Furthermore, integrating cultural safeguard principles into legislative changes, as outlined in the report from the Vienne Commission. So these are things that you can know because they're part of Quebec health policy. And when you say it, maybe you don't know about it right now, but your interviewer will, because they've been in the system, they know what these commissions are, and so on. Is a critical step towards creating a healthcare system that respects and incorporates Indigenous cultural practices and values. The plan to hire liaison officers within hospitals and other healthcare institutions to strengthen relations within Indigenous communities is a step in the right direction. So boom, another thing we're discussing right now that Quebec is doing. These officers can play a crucial role in bridging the gap between healthcare providers and Indigenous patients, ensuring that the latter receive care that is respectful, culturally sensitive, and tailored to their specific needs. As a future healthcare professional, I believe it's imperative to advocate for and contribute to the ongoing efforts to reform the healthcare system to better serve Indigenous communities. And then we give our conclusion. So see, we went deep on two topics and we gave an introduction sentence that highlights our understanding of what's going on, right? Again, demonstrating relevant knowledge of Quebec events, multifaceted way of addressing topic, and we have innovative ideas. We can support Indigenous-led healthcare initiatives, promoting cultural competency training for healthcare workers, and so on. So we have ideas to solve it. And all of our questions come with ideas to go beyond. For example, We can promote the integration of traditional indigenous healing practices within the healthcare system. So a lot of times they will believe in certain spiritual healthcare practices, maybe the shaman, and they won't accept conventional Western medical care, allopathic medical care. So maybe we need to bring someone, a leader from the indigenous community, into the hospital to find a combined approach, a middle of the road approach to provide them the care that they need in a culturally sensitive way. We encourage mentorship and scholarship programs for indigenous students pursuing healthcare professions, and so on. And then there's red flags that you want to avoid. Okay, so we're on the last section. Does anybody have any questions? All right, first impressions, personal questions. So here's a tip. First impressions matter a lot. In my thinking time, I would always practice the first sentence I was going to say. So when the camera turned on, I would say it with confidence. I would say it so well. And that made a huge difference. When it's synchronous, by the way, I always introduce myself. Hi, my name is Kevin. Bonjour, je m'appelle Kevin. Et, je suis étudiante à McMaster. Right? I'm a student at McMaster University. And I would, what I would do is ask for their name. With whom do I have the pleasure of speaking with? I would smile. And this was a very mature way to get their name so I can address them by their name. And then at the end of the interview, I would say, oh, thank you, Monsieur Laval. Right? For example, I would talk like that, and that automatically makes you a more personable character. Now, personal questions. You could definitely be asked this on your MMI. Like, what is the biggest challenge that you overcome? Why do you want to be a doctor? Especially relevant to follow-up questions, okay? Here are categories that I really like. I would have 2 to 3 stories per category. These come from the CanMeds. You can look at the CanMeds. I think most of you know what CanMeds are. I like the American list. This is the American version. I would have 2 to 3 stories for all of these because, look, what is the biggest challenge you overcome? This addresses overcoming conflict, resilience, capacity for improvement, problem solving, and so on. So to answer personal questions, you want to use something called the STAR method. STAR, and it stands for situation, task, action, and result. So let's look. Last semester in the McMaster Bio Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. Okay? S and the T, you want to get rid of this as quick as possible because you don't get any points. AR, this is where you show your values, your problem-solving skills, how you think, your critical thinking, and those CanMeds rules that I spoke about. This is where you get your points. And for me, the first year that I interviewed, I would spend like half my time describing the situation. Oh, I was in a research lab and the professor was doing this and they couldn't make the meeting on Tuesday. And I would spend half my time doing that, boring the heck out of my interviewer and getting no points as a result. So make sure your stories are very quick so you can get here. Consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approach the most promising ones to renegotiate terms suitable for our budget. I used strategies like calling suppliers instead of email to ensure rapid communication. Ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. Beautiful. We talked about the strategies we used and the kind of person we are, the skills we use to overcome this challenge. However, there's a missing letter in this method, and it should be called the START method. Why? Because the T stands for takeaway. Where possible, every single answer in my MMIs would have a takeaway, either a personal story or a relation to my future profession, and it'll often make sense which one you use. So let's look. We're going to give the same answer. Obviously, this isn't the biggest challenge, right? It's just the challenge. But now let's look at the takeaway. As I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills, along with problem solving, I will continue to ensure team needs are met for the benefit of my future patients. This is beautiful because not only did you give a very mature answer here in the colored part to this question, a very well-organized and mature answer, but you gave them something else. You gave them something that shows that you're mature and you've been thinking and reflecting on your future career. What is it like to be in medicine? Well, You need strong communication skills, right? So you're showing your values and who you are and your maturity by having this takeaway. And this is a hack. I would have a takeaway for all of those categories that you saw, right? All of these. A category for communication, like for example, for collaboration, I would say, oh, as a future medical student or a future physician, I'm going to be working in multidisciplinary teams, providing team-based care, holistic care to my patients. And this is something that if you want to say something else, if you don't have too much to say, you can always have a takeaway that will connect to the question, and you can say it perfectly at the end because you've practiced it 100 times, and it's going to be a very mature bonus, to your answer. So again, have stories, 2 to 3 stories for all of these pillars that reflect your values, your future career, that reflect the CanMeds roles. So integrate them into your stories. Don't make them too forced. And the medical school. So no one does this. This is a big secret to how I did so well the second time, because in the United States, where I am right now, there's more than 150 medical schools, okay? 150 medical schools. Top applicants will apply to 30 medical schools, get interviews at 20 medical schools, and get accepted to 10 medical schools. Okay? I don't mean to make you sad, but it's the truth. And here in the United States, the medical schools ask you, why do you want to go to this medical school? Because they want to know, well, there's a lot of medical schools, you have a lot of options, why us? And it's important that you give a great answer. However, no one does this in Canada. It's because in Canada, you're lucky to get a single interview. You're lucky to get a single acceptance. So I have been asked one time in my Canadian interviews, but that's about it. Why do you want to come here? But a lot of the times in my MMIs, especially, I was able to provide really cool answers. For example, imagine McGill asks you a question about antimicrobial resistance, antibiotic resistance, right? A lot of bacteria are becoming resistant to antibiotics. You could give your answer on the health policy, on the science, and whatever, and then you could mention McGill has one of the premier antimicrobial research facilities in the world. And as a future medical student, I would love to contribute to research, in that department. And just by knowing a fact like that, knowing McGill's public health initiatives, global health opportunities. Maybe they send people to Dominican Republic to learn global surgery. Maybe they have cool clinical rotation sites in different parts of Quebec where you can, interact with indigenous communities, right? So if you get an indigenous question, you can say, oh, I know McGill has these training sites in this area where I can gain experience of that. And you can actually find a lot of cool ways to integrate information about McGill into your interview. So go on McGill Medical School's website, go click on all the tabs, all the research departments, get a lot of cool information about it, because that is going to shine in your answers, because you're going to get that question that's like, oh man, I know the coolest thing to say that's going to be very specific to this medical school, and it's going to help your answer stand out, okay? So last section, pro tips. Organization. So organization in your answers is about letting your amazing answers get the recognition they deserve. And always in my first sentence or two, I give an outline of what I will talk about. So for example, hello, I will begin by addressing the pros and cons of implementing such a public health policy before giving my opinion and then relating it to an experience I've had in the area, This is amazing because everybody is saying the same answer to the same questions, right? Your interviewer has seen 20 students before you say the same boring answer to the same question. But you are giving them exactly an outline, which makes it easy to follow. First of all, other students don't give an outline. They start talking and then they forget what they're going to say, or they say something and then they remember, oh, I should also talk about that. So they go on a tangent and then they forget the rest. And it's a big mess. It's hard to follow. When you give an outline like this, it makes your answer very easy to follow. And then look at this. I'm going to relate it to an experience I've had in the area. This is a way you can go beyond. You can stand out. In fact, if you say this sentence as your first sentence, you have already stood out before you even said your answer. because now it's like Christmas. It's like Christmas for your interviewer. Not only are you going to give them a great answer to the question, but you're going to give them a personal experience. Now they're like, wow, I look forward to hearing something different, something cool at the end. And they're going to love you for it, okay? So always organize your answers at the beginning. And you could consider doing a conclusion. I personally, if it was between giving another idea and giving a conclusion, usually I give another idea, but conclusions are always good too. Avoid extreme stances. This sounds like, okay, obviously, but it's more nuanced than you may think. For example, let's look at this question. Should pharmaceutical companies be allowed to provide gifts, such as free samples of their latest medicinal compounds to physicians? What does everybody think? For me, I would be like, no, pharmaceutical companies are bad, right? It's a conflict of interest. It's a conflict of interest. No, 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 no. This is a bad idea. But if you sit down and think, and you be a little bit more mature, think of this. What if you're a doctor, you have patients who can't afford certain medications? In Quebec, we have Medicare, which means healthcare is free at the point of service, but we don't have pharmacare. We don't have pharmacare in Canada. Drugs, medications are not free. You have to pay for them. You have to pay for your antibiotics, or you use your mom's, your dad's, your parents' insurance, or your own insurance. So what if the pharmaceutical company gave you those gifts, those drugs, now you can give it to a patient who needs it. Maybe it's going to save their life or help treat their chronic condition. You can give it to them for free now, which is going to help that patient. What if it's a drug that's actually really good and now you're not going to learn about it and a lot of your patients could have benefited from it? What if the company is like Sanofi Pasteur, which is part of the Canadian economy, a big part of the local economy, and now if they can't market to physicians like this, then they're going to go bankrupt and a bunch of people are going to be fired and they can't make any more drugs, and now we have to buy our drugs from the United States and pay 10 times more for it. There's a lot of even if someone seems evil, right? Because a lot of us think pharmaceutical companies, evil, evil, evil. Even if someone seems evil, be mature, sit down and think about what perspectives could they have? What beneficial things could this bad thing provide? Because usually it's a lot and usually people don't say it. I guarantee you more than 90% of people are going to be like, nope, it's a conflict of interest, and they're not even going to entertain the other perspectives I just showed you, okay? So please think about those perspectives. Study at night. So when I was a teenager, I read this book, The 7 Habits of Highly Effective Teens, and it told me what you do 1 hour before you sleep gets replayed in your brain 6 times more than anything else you did that day. This is why before I go to bed, I don't watch the news. I don't go on Instagram. Because what does it say? Oh, this person got killed. There was a shooting. There was a car crash, blah, blah, blah. And then you have bad sleep. Or if you watch a horror movie before you go to bed, you're going to have nightmares, right? I always prepared for my interviews before I went to bed. So the perspective-taking mindset would become ingrained into my thinking. It would become my natural thinking instead of something I'm just memorizing for my interview day. Lastly, everybody's studying the same books, the same stuff. I would listen to Nature Biotechnology. I would read the MIT Technology Review, the Financial Times, the Wall Street Journal. I would go to the gym, listen to podcasts on economics, finance, technology. I would get a lot of diverse perspectives that really helped me provide compelling answers that stood out compared to everybody else giving the same boring answer. Zoom out. A lot of the times you might not see the question. If you can, so if you're using Zoom on the web, do this, but if you're using the Zoom application, then you're fine. Lastly, share videos of your answers with colleagues. So this is what I'm going to show you. We have medical school question bank, over 100 questions with answers, expert answers. You can go here and just like your McGill interview, you can say, I want 8 questions, only give me 1 minute to read it, and I'm going to practice answering in 4 minutes. And you can create your test, begin. All right, what do you think makes a good physician, and how do you embody these qualities? And you have a minute to think. There's a lot of questions. What lessons do you think we can learn from the response to the COVID-19 pandemic and preparing for future pandemics? Beautiful. After a minute, you can begin your response. You're going to talk to the camera, say your answer, And then when 4 minutes is up, it'll finish. You can save your video, send it to friends, review it. Are you talking at a natural speed? Are you shaking your hands too much? Are you looking in the camera? And then you can review the expert answers, ideas to go beyond, and red flags to avoid for every question. Lastly, practice, practice, practice. So there's a lot of topics for you to gain not only knowledge on, but be able to provide expert opinions on. So I will send you this list. And again, we have mini question banks on Quebec health policy, other provinces, which is huge, opioid crisis, AI in healthcare, American health policy. This is very important because a lot of the times I would get asked the question, what do you think Quebec should do? What do you think Ontario should do? And my answer would include, well, okay, this is what I think. Also, here's what the US is doing, because I did an exchange, I did a study abroad in the United States, in Texas. I would say this is what Germany, the Bismarck system in Germany is doing. This is what the NHS in England is doing. So learn about other healthcare systems, and it's automatically going to make your answers shine because nobody else is talking about that. Telehealth, alternative medicine, British Columbia, Manitoba, genetic testing, CRISPR, vaccine ethics, mental health, so many questions. And by the way, our Quebec question bank has French questions as well. So you can study in French. We will be giving you a credit code for our question banks that will come with the slides right after this presentation. So be on the lookout for that. And that is it. Does anybody have any questions for me? I told you I'd be done before the time is over. So.